My name is Cassandra Fayad, and I will be presenting information regarding working with Maya. Maya is a 13-year-old female who displays signs of self-harm. She resides with both her parents and her younger sister. Her parents share their concerns for the example that she is setting for her sister in regards to self-harming and suggest that it is attention-seeking behavior. She has a history of childhood sexual abuse from a private tutor at 8 years of age. She received counseling at the time of the abuse, however, in the last 12 months has been self-harming. A study conducted by Sawyer et al. 2018 indicates a link between social anxieties and post-traumatic patterns. Maya displays social anxieties in different settings. This includes in the educational setting, eating in front of people, going out to the shops, as well as online interactions. She displays rather closed-off body language, displaying avoidance in eye contact, sitting slumped, and minimal conversations. Her history of child abuse increases the anxiety, emotional dysregulation, and avoidance, according to the study by Gilbert et al. 2009. Maya is in her early adolescence years, which already poses its own challenges. This age is crucial for identity formation as well as social-emotional development. Erikson, 1968, describes the adolescent years as a critical psychological stage. Emotional responses and reactivity is normal for this developmental stage as the limbic system develops faster than the prefrontal cortex, according to WHO 2020. Research indicates that trauma experienced in childhood disrupts the development of emotional regulation, attachment, as well as identity formation, particularly in the early years. Vanderkalk, 2015. Furthermore, there are more studies that indicate that self-harm and other impulsive behaviors are increased at this developmental stage, according to Patton et al. 2014. It is important to have an understanding of the impact that Maya's challenges play on the various domains in her life. Breyer and Scott, 2014, discussed the long-term effect that trauma plays on the stress system. Stresses in her life, including lack of support by the family, may result in worsening symptoms, according to Ungar 2015. The anxiety and shame that Maya appears to experience also coincides with trauma literatures, according to Chu et al. 2022. It is important to take into account family dynamics and culture. Often, parent minimization occurs when trauma is misunderstood, according to DeLuca et al. 2020. It is also important to consider the challenges faced by the family in regards to culture, shame, confusion, stress, etc., as well as the potential for secondary trauma or distress, which could potentially present itself as frustration or blame, according to the Family Institute Studies 2021. Continuing without support could leave Maya in a difficult situation. Cash and Bridge, in their 2009 study, discussed the risk of ongoing self-harm in individuals who do not access adequate support. There is also research that indicates that Maya may be at risk of developing suicidal ideations, according to King et al. 2019. In studies conducted by Nock 2010, ongoing self-harm and non-suicidal self-injury often serves as a form of emotional regulation for young individuals as it provides temporary relief from their reality. Providing the necessary support, intervention, and guidance is therefore necessary to reduce recurring behaviors. Information from Stanley and Brown, 2012, provides suggestions that cases, such as Maya's, may require a risk assessment. In this study, it explains how risk assessments, conducted in the right setting and non-judgmental manner, could assist in emphasizing safety rather than control. The Australian Psychological Society, APS, gives insight into the importance of autonomy and confidentiality, as well as maintaining respect and choice for the individual. The Australian Health Practitioners Regulation Agency, AHPRA, discusses principles of beneficence and non-maleficence, prompting us to encourage positive well-being and avoiding harm in their code of conduct. Furthermore, the National Mental Health Commission Framework 2022 encourages cultural safety and creates an environment that allows clients to feel safe, understood, and welcomed regardless of their circumstances. In Australia, laws aim at protecting minors. Mandatory reporting obligations apply to individuals working with children in a range of capacities, as outlined by the Department of Community Justice DCJ 2025. Laws regarding consent of minors through the GILIC competencies also apply in Australia, whereby a young person who displays enough maturity and understanding may consent to their own treatment, according to the New South Wales Health 2020. Working with a young individual such as Maya would provide barriers regarding consent. APS provides a guideline on confidentiality and its limits. It is important to explain this information to Maya, potentially assisting in reducing anxieties surrounding disclosure and prompting engagement. The HEADS assessment is a tool used for the assessment of adolescents, which provides a detailed assessment of the individual. Implementation of trauma-informed care principles encourage safety and empowerment, according to Bath 2015. The Centre for Community and Child Health also discusses the significance of using the family partnership model to promote engagement in the families and communities. 2015. The use of trauma-informed care focuses on crucial aspects of a young person's life, including psychological safety, as well as the foundation of trust, according to Bath 2015. The implementation of trauma-informed communication provides safety and supports the autonomy of Maya. Providing Maya with choices that follow the ethical guidelines for adolescents would prove to be beneficial, according to APS 2017. Engaging the parents in psychoeducation in order to create more awareness and understanding surrounding the nature of Maya's mental health and experiences is an important part of the process, DeLuca et al. 2020 explains. The National Mental Health Commission 2022 highlights the importance of cultural safety, which involves fostering environments whereby power imbalances are recognized, allowing the client or individual to feel respected, heard, and understood. Challenges faced in engaging the individual can be dealt with in a few manners. It is important to set clear boundaries and create awareness following the APS Ethical Recommendations 2017. Taking on trauma-informed responses will assist in reducing triggers and stresses, according to Chu et al. 2022. Working with Maya needs to account for her age, developmental stage, environment, as well as the concerns presented. The best practice approach for Maya combines trauma-informed care, concerns for ethics and collaborative planning, and an inclusive family approach based on research by DeLuca et al. 2020. Careful consideration must be given to the various domains in Maya's life, and providing necessary education to her parents prior to collaborative planning is a necessary step in moving forward. Engagement is necessary in order to reduce further risks and assist Maya in moving forward in her life. Thank you.